First, I wasn't sure what they were showing me on the camera when they showed me the tumor. And then when they told me it was cancer, it hit me quite hard because I didn't expect at such a young age to be diagnosed with cancer. Being the eldest, I wanted to make sure that I was well enough to be able to take care of my younger siblings. At that time, two of them were still studying, so I wanted to make sure that I was in a good shape to provide for my family as well. I spoke to the surgeon. He told me that he'll be removing at least about a quarter of my liver, and he would be performing an reverse L surgery, which would take up a bit of my a huge chunk of my body out of me. So I was concerned because being an active person myself, I was afraid that it might affect my movement and my ability to do any sports or anything else at that moment. Also, the recovery would take quite long, and as with every surgery, there would be complications, so I was quite worried about that. I just happened to send my CT report to Dr. Xiao Chun at Paragon Medical Center. He was my surgeon at the time. So when he saw my report, he asked me why I did not consider SBRT. I told him I didn't even know about this treatment, and then that was when he referred me to Dr. David Tan.
So when Haziq came into the consult room, in front of me was a 28-year-old young adult, with physically active, and at the same time, he was a man who had lots of ambitions for life. Setting up a family, establishing his career, and so forth. So I think for me, the issue that I had to confront with, or rather think about with Haziq was there an alternative to surgery? An alternative that would grant him an equally successful outcome as surgery, and at the same time, with less side effects, with less impact on his quality of life in the long term. And so that is where the discussion on SBRT came in. SBRT, Stereotactic Body Radiotherapy, is one of the most advanced forms of radiotherapy where we utilize state-of-the-art radiotherapy machines, decades of clinical experience, and also new technology and accessories to allow us to direct a very highly focused radiotherapy beam into the body to destroy tumors in situ, or tumors where they are. It is considered a form of bloodless surgery where the radiotherapy beams destroy the tumor without having to remove them. The tumor cells die off, and thereafter the body will then take the dead cells and expel them from the body on their own. And so over the years, we have gained so much experience in it that SBRT is now listed as one of the alternative options in international guidelines to treat patients like Haziq, right? Patients with stage 4 cancer where there may be disease that has spread to only 1 or 2 sites, or even less than 5 sites in the body. In such cases, rather than to go in with surgery to remove all the nodules one by one, and as a result, remove a lot of normal tissue and normal organs together in the process, just like in the liver, SBRT can actually bloodlessly destroy the tumor with minimal collateral damage, thus saving the patient, a big surgery and weeks of recovery, number one, and secondly, reducing their side effects as they receive the treatment, so they're pretty much going about their lives normally with minimal disruption, to their work, to their families. And thirdly, preserving his long-term quality of life, allowing him to pursue his goals, whether it be family, work, or in life in general, with minimal impact.
To be honest, my dad wasn't too keen on SBRT because we didn't know anything about it. I mean, the only other option given to us was surgery, and surgery has been around for so many years and the results have been proven. So my dad was a bit skeptical about SBRT, but after seeing Dr. David and discussing with my dad personally, I managed to convince him that this is what I want, and I decided to do SBRT. So after the subsequent SBRTs, I didn't feel any different than I did before the treatment started. So that was a really big positive because I managed to do all of the things that I still did before that. So I was quite happy with my choice. Honestly, I found out that there were no active cancer cells in November 2022, but during September, during a blood test, that was when the tumor marker dropped below 5. And I remember being in the car and calling my wife, telling her about the result, and I was crying because I was so happy about the result. Being an active person myself, I participated in a lot of sports. I play football, I go karting on the weekends, I do running, cycling. So all of these were quite important to me because it gave me an escape. It let me know that I was still able to do all of this even as a cancer patient. So I didn't feel out of place. So it also made me feel a lot better about my body, because it helped me throughout the treatment that I was fit and healthy. It wasn't as taxing as it would normally be. So I find that exercise is quite important. I was due to get married in June of 2023, but I only found out about the lung mass in May of 2023. So it was about a month before the wedding. I discussed with Dr. David what are my options and what is the timeline that we have before we act on the tumor itself. So he told me that it will be okay if we do it in the middle of June. So that helped me a lot because it allowed me to proceed with the wedding as planned, and thankfully nothing bad happened to the tumor. Like, it didn't increase in size, so it was all good.
I'm actually grateful for both families because my parents and his parents, both family were so supportive. They decided to, okay, we just make it simple. We focus on what matters the most. So his treatment, his condition is the most important. So I think for me, I tried to be more flexible. You know, like people have dream wedding, what they want it to be. But in that point of time, what truly matters to me is he okay? Will he be comfortable? Most important thing is him. At that point, really, I put him first and then only myself. So I tried to be there to support him physically and mentally, emotionally.
Thank you so much to all of the radiologists here who helped me throughout all of my sessions, and also to Vanita who helped me liaise with all of the appointments and taking my blood all the time. So thank you very much to all the ARO staff. Dr. David, thank you very much for all of your help and expertise. Honestly, I couldn't feel more comfortable with any other doctor as I have with you, because your input definitely helped, made my journey much easier. So thank you very much. Thankfully, I'm healthy now, and I'm looking forward to living each day to the fullest. I'll be hoping to do some of the things that I wanted to do, which I couldn't do during treatment, such as traveling, exploring more, and doing stuff that I love to do with my lovely wife. Well, I'm traveling to Korea at the end of the month, so that will be fantastic. Something to look forward to. Yeah, I told my wife, I said, "You want to go to Korea? Since you're a fan of all this K-pop and stuff, right? So why not?" And the first thing she said to me was, "But I don't want to go with you. I want to go with my friends." Because the reason is that I wouldn't appreciate the K-pop culture down there as much as she would. So I said it's okay. Why not we go to Korea first? I'll see for myself, and then you can decide whether you want to go with your friends in the future.
Yeah. So after we decided to go Korea, right? So I have a lot of things that I wanted to do because I love K-pop. But then when I asked him, okay, let's get something that you also want to do, then his answer like, okay, let's go hiking. And I was like, huh? We are going for travel. So I'm still thinking about it. So we will see. We're going to hiking.
We'll let you know whether the hike makes it into the trip. I know that it's not easy being a cancer patient. I'd like to tell you guys to hang on and persevere. It's not the end. I know it's not easy. It's a bit difficult. Sometimes you feel down, but there are other times where you have to pick yourself up and just persevere through, not only for your sake, but for the rest around you, like your family, your relatives, your friends, your loved ones. Keep fighting and don't give up.